everyone. It's just going to be Dr. Williams today. 30 minutes, one question, one follow-up, and I'll turn it over to him for some remarks.
Yes, good afternoon and good 1st of May. And so I said we finished another 14-day cycle, and that has demonstrated, as we're hoping to do, that we were wanting to see that we would maintain our plateau in the hospital cases as well as in ICU and that aspect. We wanted to give some evidence that our public health measures were continuing to bend the curve in our community cases, and we're seeing that we have at least plateaued, if not starting to bend it even more. And that, I think, is to the efforts of all and people doing that. So by staying the task, we continue to move ahead on this portfolio. And as well, it looks like we're starting to make some steady headway in our long-term care facilities, but early days. We're trying to see how that will be. Also see if we can bend the curve on that one and bring that down as quickly as we can because of the concerns we have in that regard. So I'll comment a few more on the next time here. The numbers for today are that we have another 421 cases in IFAS reported today. That gives us a total of 16,608 for Ontario. And the demographics are about the same as we usually. The number of healthcare workers is 2,419, cumulative total since the beginning in January. We continue to have people recovering, and we're up to now 10,825. So that is a very good news aspect there at 65%. So as I predicted, that will continue to rise and keep going up. In the hospital, we've seen an increase in the hospitalizations. And as I said, some of that's the impact of our long-term care concerns and lack of and holding back on some of those repatriation from hospitals to long-term care facilities at this time until we get things under control. On the other side, the ICU and the vent numbers are down, and more than just a couple, so that's a good news aspect as well. Still seeing deaths, unfortunately. The amount is not as high as we've seen the last number of days, an increase of 39 for 1,121, so certainly not in the extent we've seen in the last number of days. As far as long-term care is concerned, we have 166 active outbreaks, so that's an increase of 3 since yesterday. And the number of deaths related specifically to the long-term care data is an increase of 26. So that's pretty close to what we saw with the IFAS one, so there is some continuity and agreement of the numbers there, a bit better than usual. The retirement homes, they have 61 homes in an outbreak. And again, some of these numbers are still being clarified because it's a new system for them. We have 555 reported in residents, cumulative, 9 new ones today. 75 new cases reported among staff for a total of 324. And no changes in the deaths in the residents of the retirement homes. The good news is on the testing side, we've now done 294,054 tests. Yesterday we reached a new high, having done 16,532 tests, and there's still just under 12,000 pending investigations. So my guess is that that number would be close to being equaled tomorrow, if not exceed a bit, but we'll have to wait to see. So, and today also you heard from the Premier that with consistency with our recommendations of our public health measures, they have noted a number of areas where they have asked businesses to consider those and put those in place to start some aspects in preparation for on Monday. And I'm not going over the list because you have that there in that regard. So in that sense, we'll continue to have those discussions and making sure that the public health guidelines under our current pandemic containment, still we're not into stage 1, will proceed forward. So the next 2 weeks, continuing to see if we can bring this curve down, drop those number of community cases, as you can see with the number today, which is a bit better consistent with the last few days. It means that if it's 50% of long-term care, we're coasting about the mid-low 200s in community. We don't have the exact number, but that means we're in the right ballpark to start thinking about, are we going to be moving down to actually where we can make some serious considerations. As I said before, that was well below 200 when we started to see the loss of containment and more community spread closer to around 100. So we've got to look at all the data points, our transmission rates, etc., from our committee as we look at this and continue to segment the data, look at it more carefully to give the best advice we can to government officials to make decisions on the recovery phases and economic recovery in that sense. So, again, our messaging, if the sunny weekend, that I'll finish up with those comments, but it's going to be a warm weekend. Everybody's always asking what I'm saying. I said all along, I don't mind people going outside, people getting exercise, but plan it. Don't just go out and go to the most crowded places. Plan your timing, plan your route, plan your areas so that you're not put into an area where you're in congested, where you lose your physical distancing. And if there's a chance you might be, you should wear some facial covering, but that's not an excuse to say, I have a facial covering, therefore I'm going to negate the need for physical distancing. That's not the means and method why we're trying to do that. So enjoy, keep safe, keep distance, and keep well in that. So I'm going to open up for questions now.
Okay, we'll move to the phone lines.
Your first question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Dr. Williams, glad to hear you telling people to distance themselves but enjoy the weekend. I'm wondering, though, why you continue to be on the side of those that say that we shouldn't be opening up even more. I look at people lined up outside liquor stores, Dollaramas, Loblaw stores, Metro stores, and wonder why we couldn't practice social distancing, lineups, and everything else when it comes to hardware stores and so many others. Why are we allowed to wander the aisles at Walmart looking at all the things that the hardware store sells, but not allowed to go to an actual hardware store? What is your thinking on that?
So our thinking on that is that when we did this staging back with calling so-called essential businesses, we felt that the government felt then that grocery stores and food supplies were a priority. Some places that sell more than just groceries and other essentials, I guess, could be included in there. And I know the government is very concerned in saying, on a go-forward basis, how do we work within the current constraints of the distancing and look at some other facilities to see how they might undertake that. And you're seeing that the government today announced, effective Monday, certain places like garden centers and nurseries could do curbside pickup and delivery only, and other ones looking at that. And I think that some will have to look at, if we did do something like that, how would we endeavor to do that and maintain all the parameters of physical distancing that some of the essential food stores and others have undertaken in that regard. So there's always that need to build up and look at that, and as a result, I think there's always exceptions in different areas that sort of cross over, and how to mediate that and to look at what's fair and what's not fair. So I think as we go through this recovery phase and move there, there'll be this large, full of government way to look at all these different things and how to ensure reasonableness, fairness, effectiveness, and efficiency, and safety throughout the whole process.
Okay, you can have a quick follow-up, Brian.
Are you actually looking at fairness across the economy? Because I'm hearing from a lot of small businesses, be they golf courses that say they could open up and practice social distancing, or small stores that say they could practice social distancing, but they're not allowed to open, but the big stores are able to open. So are you considering the full economy, or are you looking at it from a completely different lens due to your public health bias?
My public health lens is giving guidance as far as health aspects. So we still give the same levels of the distancing. We give the ideas around that we have all along, and at this time, because we have not seen the drop down to where we can change some of those to any level, if the government in decision making and in their groups that are working at things want to consider other things within that framework, we've given the guidance and the parameters, and so that's open for other sectors. But I'm not making that decision myself from my desk as to which retailers, which company, which group, and this one, because the complexity and breadth of it is related to all sorts of aspects of labor, occupational health and safety, all sorts of factors that require a lot more intensive work by various ministries and sectors throughout to look at dealing with those issues there, and no doubt are starting to look at and to address some of those matters, but they're not coming from my desk per se, because we don't have that depth and breadth of all that kind of knowledge, nor the legislative responsibilities to regulate that and to carry that forward.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. That was a nice jump in the testing numbers. How did that come so all of a sudden? It was like 3,600 new tests processed, and there's still, looks like that 12,000 that's awaiting testing, though. Is that going to create a backlog for you?
Well, yes, and I said before what we were dealing with there was a flow issue of samples coming in because the public health had undertaken an assertive province-wide testing of all long-term care homes, first ones in our so-called red zone and some outbreaks in some of the other zones in their area. And that was done very assertively over the end of last week, all over the weekend and early into this week. So we hope to complete that phase we completed by Wednesday. All those samples coming in from 34 different entities around the province, as you can imagine, start to come in fairly robustly, and that's why you saw the big jump in the numbers. And now the 12,000 from yesterday was pending, and 12,000 again today. So you can see that number hasn't accrued, but it hasn't disappeared because even more tests have come in. That is in the range of what all these different labs can put through in their 24-hour periods, so they don't see it as a backlog. It's more of what's queuing up for the next 24-hour day's work. And even now we're going to start ramping up even more continuing testing of the other homes. So I can't see us backing off that number anytime too soon until we have undertaken and completed that task over the next number of days and weeks to do that. So I think we're going to be ideally keeping this number up fairly high over the days ahead.
Follow up?
Yes, I just wanted to follow up with what is the actual testing capacity right now, do you believe?
The testing capacity that our group works at is about 19,525. It's around 19,500 a day, and that they're continuing to look at other methods to say, can they actually enhance that any further in the future? So they haven't said that's it. There's still some exploration and looking at this matter further.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Dr. Williams. I might be wrong, and I apologize if I am, but I think this is the first time I've heard you say if somebody's going to be going out and getting exercise to wear a facial mask if they think they might be in a busy area. Am I wrong?
Yes, because I said before, while we want the physical distancing, because people ask me, even last week, what do I think about facial covering? And I said before, while we haven't recommended strongly, the more important thing is to keep the 2 meter, 6 foot distancing. But if you're going to be in situations where you think you might have to be compromised, say on a transit system or somewhere that you might get involved with a crowd for a couple of minutes or so, you may want to choose to wear one. My point has always been to say, by wearing a mask, you can say, well, then I don't need to worry about the 6 foot distance. That's not the message. So I've always said that, and that's still my position. So when I'm saying you're going out for enjoying the weekend, if you pick your route right, you don't need a mask, especially to keep 6 feet away from everybody the whole time and enjoy the weather, outdoors, et cetera, et cetera. Pick the time of day, pick the right place, don't do where everybody else goes, all those things there. If in your movement and transit, especially in dense urban areas where you may have to be in, it's like a busy street or section to get to your place, or potentially on an elevator for a minute with someone else, you may want to consider having one to give you that protection because you didn't plan on that, but that's just the way it worked out. So it's a bit of a back plan, a plan B in case you can't do that.
Follow up?
Thank you. My next question is, I mean, it seems with the announcement today of what businesses can start to reopen and golf courses can start to prep, it seems like it's largely outdoor industry. What would be next? I mean, it seems we're in maybe day 6, 7 of a downward trend. What would you be considering? Which industries would you be considering opening up after this?
Well, there's 2 parts to that. One is that a lot of them, some of them are outdoor because it's spring and it's coming that, and people want to be outdoors, so they want to give some encouragement for people to do those type of activities in there. I would say what's next, it depends on what the government decides what's next. As I said, we give the general broad guidelines around which phase we're at, and then as the government officials in other sectors in the ministry, etc., look at a variety of different industries, businesses, retailers, etc., they will put that into consideration and vet that through, because then there's going to be a lot of guidelines and things that have to come out before you even allow that to happen, if you were going to do that, and to continue to help and assist on what the Premier talks about, economic recovery, and the province recovering and coming back in that phase. But as you can imagine, there's a lot of different ministries and sectors that would have amount of work to do to bring those recommendations forward. Again, following the general guidelines that we give from our committee, but we don't render and make decisions on every retailer. We just wouldn't have that capacity. It's a huge task to do, but many of the governments and ministries have that capacity within their staffing, et cetera, to undertake that type of responsibility. So it's going to be a big job.
Next question.
Your next question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Good afternoon, Dr. Williams. Wanted to ask about the stat you mentioned regarding ICU cases and people on ventilators. They seem to be trending down over the last 5 days. You mentioned this is a good sign. I'm wondering why you think that is happening.
Two things. I think, yeah, they're down. They're down. We used to see 1 or 2. It's down 8 and 6. So I think they're significantly coming down. I think we're seeing a number of severe cases being admitted, decreasing to some extent, coming through our emergency departments. As I said, the increase in hospitalizations, I feel some of that's due to some of the transfers of some of the long-term care residents over there that haven't been able to be repatriated back into the homes because of the temporary hold on that in there. So you got this difference, the hospitalizations up and the ICU and vents down in that regard. So I think and people have been on vents and things for a long period. We're hearing more, some are recovering. So that seems to be stabilizing, and then more will be released from care as we see the community numbers keep coming down steadily. The severity of the cases coming down, more people with milder symptoms coming forward, getting tested, wide variety of symptoms and that. So these are all parts of as the modeling would say, the evidence of keeping not only flattening, but coming down the other side of the curve. And that's predicated, of course, with our community cases. As their severity drops, the rates of hospital admission and then ICU and ventilation requirements would drop accordingly.
Follow up?
And on the overall rate of growth of cases, the percentage there seems to be bouncing back and forth a bit this week between the low 2s and the high 2%. I'm wondering if you can tell us just your overall impression of that over the course of the week. And, is this a good sign just generally that this is the trajectory things are on for, hopefully for the next few weeks?
Yeah, I think it's a good sign. As I said, the numbers, and we talked about that, where we bounced up to 5 and then down to 4, then way down to 3, then back up to 4. And I said that's to be expected with the lab flow. And as Rob asked earlier about why we all of a sudden hit 16,000 tests, because we're doing this wide survey. So this is a new variable thrown into the equation. And the good thing about that is that we haven't gone into the homes and found huge rates of high infection that we were worried about so far. And that's reassuring. And that base is there. So that hasn't bumped up the rate that high. But you have these two events happening, the long-term care and the community. And you're right, the community side continues to show on the average trend direction, not the blips due to lab tests and flow and weekends, etc., is looking in a good direction. So that would be my message in the next 2 weeks. As I said, if we can continue to see that, in spite of some little bit ups and downs, continue to trend down, that would be really helpful and important for us at our public health measures table.
Next question.
Your next question comes from Jessica Smith with Queen's Park Briefing. Please go ahead.
Thanks so much. Dr. Williams, the province's ISIS data shows that the method of transmission is still pending for a lot of cases that onset as far back as mid-March. Was it about that time or shortly after, or when exactly did public health units sort of become overwhelmed and lose control of the containment strategy?
Right. I think I heard it was a bit muffled. So as I said before, we were, as you look in February, even though we had a lot of people coming back in from Wuhan, China. We had a lot of people coming from Europe, Italy, Iran, other countries and that, and people came forward and gotten tested. And we contained it up to then. We were looking at 60, 80, 90 cases, new cases a day. We trended up. And then about that time around the 10th, 11th, and 12th of March, when we started seeing the returning of people on some had the earlier March break, and then we closed the schools, or the March break, the idea, in the 13th of March, if you recall. And then we started seeing even more, and the amount of returnees during that time became extensive. And these are people returning from what they had assumed was mostly from the eastern seaboard of the USA, was a non-infectious area, but obviously it was, as we found out later. And so that large influx started bringing a whole bunch of cases back in that overwhelmed I would say, the case contact system, because we had about, over a period of a week and a half, about 1.2 million Ontarians returned to Canada from the USA and from some other sites abroad, but they were already closing down international travel at that time.
Follow up?
Yes, thank you. And what will you have, what resources will public health units have as the containment becomes more important again as the economy starts to open up?
Right. So what we have is, of course, we have a lot more testing capacity than we did when we started into this back in early March, almost 3 times. And so that's available. We also have, looking at with a whole bunch of teams and committees, looking at our data systems, looking at the rigors and aspects and various components of the case containment management system throughout our 34 public health units, how we might assist in that regard. So ramping up, because case containment has many components to it, and we need to look at all those, and our command table is assertively addressing all those at this time. And with the anticipation as it comes down, we can then really jumpstart that really aggressively and move on that, especially if we finish the survey in our long-term care facilities, our child care centers, as well as anything we have to do with congregate settings. Still doing outbreaks, still looking at geographical settings and that aspect there. So all efforts are being put in there to make sure we have a machine and an entity and the staffing that can really aggressively work at this, because it's going to be with us for the next 6 months to a year at least with COVID-19.
Next question.
Your next question comes from Phil Perkins with CHCH News. Please go ahead.
Hey there, Doctor. Okay, quick question. So on Monday, we released the framework to slowly bring back the economy. Reaching stage 1 would require at least 2 weeks of a decreasing amount of new COVID-19 cases. It's less than a week. We're now allowing some businesses to come back on Monday. So are we technically now in stage 1?
Stage 1 would be where we relax the current public health measures that we put in, and that's the 6-foot distancing, stay at home preferentially, not in crowded settings, all the aspects about droplet spread and protection in that area there. If you go to stage 1, you'd start to relax some of those numbers. We're still saying groups less than 5, so we haven't eased off those. What we're saying is that if any of these things that are being considered now, they have to continue to maintain and do that. Can you do that? The next stage 1 would be saying, if you can go down and the community spread has decreased and there's containment in place and there's a number of metrics, not just one, can we say that now some larger type things can happen, and that, because that's what the public want to be persuaded to say, if for now in this type of setting, can I be assured it's okay? What kind of data and what kind of information can you tell me that says in this sort of gathering or group, I feel safe enough, and what do I have to do to protect myself? Still keeping me in my 6-foot distance, I may choose to do that. So we're not in stage 1 right now. We're still doing the same one. These ones announced by the Premier today are all would still continue and need to do those guidelines and those directions as we are in the pandemic phase right now.
Follow up?
Okay. And I think you mentioned it earlier this week about recommendations for those who are, privileged enough to have cottages. Again, people have mentioned this weekend looks like it could be pretty nice, especially on Sunday. Any movement on those recommendations for those who might want to go up north?
There wasn't anything definite from the Premier today in that regard, because as you can imagine, this involves our provincial government as well as local governments and municipalities and mayors and councils who have different concerns from different areas in that matter there. My position in there is that can that be done in respecting the concerns and issues and maintaining our public health measures, that if someone has a real, like an urgent need to go up, something's happened to their facility, their cottage, some damage or whatever, they have to go up and quickly look at it and come back down again, or do something they would do so when they're not ill. They make sure they bring all their supplies with them. They don't stay for a prolonged period and don't overburden the local resources. And it's an essential visit to deal with a matter that needs to be looked after. My sense is that that would fit that category. But then the concerns from some of the local ones, would that be followed? Will it be handled? And I don't have a direct answer for that, and that's part of, I think, the consultation would have to take place between the provincial government and the local municipalities to come up with an agreed upon approach to the whole matter. As you say, it's getting closer to the usual, I guess, annual time when people talk about the May 24th weekend is when people talk about, I think, the cottage lands and areas opening up in large amounts.
Okay, we're going to move to the last caller on the line.
Your final question comes from Mo Fahim with Vista Radio. Please go ahead.
Thank you. Good afternoon, doctors, and good afternoon, doctor, and happy Friday. My question is regarding second infection. So we've been hearing a lot of reports about it, and I believe a CBC article pointed to a Vancouver individual who did report getting infected a second time. Are there any reports of either anybody from the public getting infected a second time, or a healthcare worker getting infected a second time here in Ontario?
I haven't had them here in Ontario, and what I would say is that when you say infected, usually means the person's had a second time a positive test. And I think some of the confusion, we've tried to be clear on this, and this is a bit challenging. The test itself detects bits of RNA from the virus in the person's nasopharyngeal passage. Those may be viable, they may be not viable, or pieces therein. So a person could be tested and then be gain access, and someone else contaminate them again and have a second test. What you really want to know is that if a person who was truly infected, and that's harder to ascertain because we don't do blood cultures and looking for the so-called viral infection. The title is viremia. That would stimulate a full immune response. We don't have that kind of data available to us. So I would say we have to be careful that a person who was tested positive could be tested positive again. Were they really infected, yes or no? That kind of clinical detail, I think, has to be carefully assessed, and that's why we're looking at aspects of quality serology testing to give us some sense of, if people were infected, do they have immunity, and can someone have immunity and then not be infected again? You may, by happenstance, have some viral particles left in your nasopharyngeal passage because your immune system has eliminated being spread to the body, and your PCR test could be positive. That may sound confusing, but we're just saying, what does the test tell you and what does the test doesn't tell you? Most of the time we say when people have it, it's usually our best sense of when they're infectious, especially when it's combined with symptoms. And that's when we say, that's our best measure. You have a test positive, you've had symptoms, you've had contact with a case or travel in the past, and the symptoms, we've widened the definition because we found that some people with very mild symptoms or some newer types of symptoms that people reported. So we've widened that to do our testing, because then if they have symptoms, general symptoms, fever, ache, myalgia, that means there has to be evidence of, probably clinically, they've had infection internally. And so we take the two together as being much more evidence of a infection in that sense. So I don't know if that helped you or did it confuse you?
I think that actually that helps a little bit. I'm going to move on to the follow-up, which you actually kind of touched on, talking about new symptoms. So in the United Kingdom, clinicians kind of released a memo to keep an eye out for this COVID toe in children. Has this surfaced in Ontario, and what does Ontario Public Health, what does Public Health Ontario know or is kind of doing regarding this?
Public Health Ontario has read the reports and seen them. We have consulted, of course. We have our leading center here with hospitals for sick children to ask them if they've seen any cases in that. So they're reviewing the matter and want to be aware of it. Our information so far, it is a rare, infrequent event. Nevertheless, it doesn't preclude us from talking to our world-class experts at Hospital for Sick Children, combined with Public Health Ontario, to give us the best information possible and to assess that, and then to be able to give some evidence-based advice that is a reasonable risk assessment and aspect to the public who may be wanting. So I haven't got the final report on that particular condition, but I know they're looking into the matter at this time.
Okay, thank you, everyone.